Hi, how's it going? I'm so happy to be here and talk about mental health. I'm glad it's a topic that we can at least normalize, right? And being part of Resolution and talking to other young, ambitious young leaders, you can tell it's something that has been deep in our hearts, and we can finally let it out. So yeah, I'm happy to talk to you. First, my name is Yulkendy Valdez. I am a fellow, proud alumni of the Resolution Project family. I don't even remember what year. I think it was 2015, 2016. So they really go way back in my journey. I'm no longer running that venture. But I'm happy to talk about how entrepreneurship has really helped me define those boundaries around my mental health and my well-being through this call.
Hi, Yulkendy. I'm really excited to talk to you because we've spoken before, so this is like a fun continuation. But my name is Lauryn Mwale. I too am a proud Resolution fellow. I guess we've never become alumni, so just fellow. I joined much more recently. I was part of the COVID cohorts, which made for I guess a weird onboarding. I think everything during COVID, when we had to do everything online, was a bit tilted. And I am someone who's not a fan of online events as well. But I had lovely, lovely conversations with people that weekend. I had a wonderful relationship with my fellow mentors. Um, and I'm excited to talk about mental health and well-being too, because I too have closed my venture. And I think there's also scope to normalize that as well.
You said COVID, and right away it's just interesting, right? That to think uh like life before COVID and after, because I think for me that's when my mental health journey became loud and clear, and why you're meeting the Yulkendi right now that's sitting at a coffee shop in Vietnam. So as much as I try to be in a quiet space, I'm actually seeking like noise, joy that reminds me of back home in the Dominican Republic. So right now here in Vietnam, I've been doing a sabbatical since the last days of 2023, and I'm just so happy that I gave my time that time to myself to escape the expectation of what you're supposed to do, what you're supposed to keep chasing, and what we deem to be quote unquote success. And being born in the Dominican Republic, moving to St. Louis, Missouri, and leaning into being a woman of color, and understanding myself now as a Black woman in America. Leading up to COVID, I think my body finally felt it in ways that I never felt before. The level of fatigue, exhaustion. And I think that's why, fast forward 2 to 3 years later, you see me here in Vietnam trying to finally find my joy. So I'm just glad you mentioned COVID, and also reminded me of us being in the same community, how our experiences were fairly different as you interacted with Resolution during COVID, where back when, in 2014, I was at Harvard pitching in person. You were able to even meet your
Oh,
guides
that
in
sounds so
person.
cool.
So I'm definitely want to hear more about you, and what was it like building your venture during the pandemic, and getting the grant and getting going.
I think it was because COVID happened, not really overnight, but in a way overnight. And I remember being at a party in January of 2020 and talking about like, oh, there's this thing on the news. And very much 3 months later, the UK shut down. And many countries like then began to close their borders, have a stay-at-home orders and all of that. I was building the venture with a friend, and we didn't live together, but we lived in like the same like apartment complex. So, you know, COVID happened, but suddenly we like had more time and we were so close to each other. We're in our little COVID bubble, discussing this and ideating and dreaming. And in a way, it was a massive asset to now have no ability to be distracted and build on this thing that we had talked about in vagaries for maybe 4 months before we said we should actually figure this out. And I feel very lucky that COVID gave me gave me space and time to really think about something I cared about. And of course, COVID is existing now. It is continuing. It very much was a massive factor in all of our lives for about 2 years there, maybe 2.5. And that what COVID did to enhance the validity of online experiences, online education, just existing on the internet was really helpful to my venture because my venture used to be online first. But I am someone who personally loves and benefits so much from in-person interactions. First of all, one-to-one, but also second of all, in person. And the mental switch it took in my brain to be like, I need to keep referring to this online only thing was a nice challenge to accept. But now that I've closed my venture, I'm doing more in person, on the ground kind of things.
I guess that's the elephant in the room. I'm wondering, why did you close it?
I don't I haven't figured out a pitch line as to why I closed it. And even saying close is such a new term to me. I think for a long time in my brain and to other people, it's been like on this indefinite leave. Um, but it was when I began the venture, I was a university student, and there's a way that your schedule is really flexible at university, and that flexibility doesn't exist when you have a full-time job. And I just happened to have a job you know, that required a lot of energy and took up a set number of hours a day, and trying to do my venture during the night, like at night after my job and throughout the weekends, on top of other things that I was doing. Around the time I was running my venture, I was also writing a book. I wrote a book about young Black women's experiences in STEM, and that was also the focus of my venture. And juggling those three things, amongst other things like hopefully eating well and seeing friends, proved to be impossible. And I was so completely fried. I was in this cycle of being like hyperactive and like achieving, ticking my to-do list, my like endlessly long to-do list every single week. And then there'd be a week when I'd be like barely a human being, not making any sense when I referred back to my notes, just like, what was this thought? This thought doesn't make any sense. Um, and I, had to sit down and be really realistic. Like something had to give. And fortunately, I'd finished my book and I'd sent it off for publication, so that was gone. But it was still too much. And I think I am someone who was really driven by my passion and excitement. I was really invested in impacting the gender STEM gaps, specifically for young Black girls. I really cared about it. But the reality is, I would only do it badly if I did it from such a state of emptiness. And I, paused the venture for a little bit of time. I, was back at it like I think 3 or 4 months later. But I needed physical rest. I needed mental rest. I needed to travel. I needed to actually have hobbies. I was someone who's always busy and always doing stuff, but all of it was really productive work. And I needed to make space to have an interest that, wasn't necessarily productive at all. And in all of that, I came to a gradual decision that I continue to care about young Black girls in STEM, and I can continue to do work related to that. But the work is going to have to look different to exist alongside other things in my life.
Oh my gosh, that is really so beautiful, and I'm glad you gave that time to yourself, because I remember around the pandemic, it wasn't only us. Like, I talked to a lot of people, a lot of entrepreneurs that were getting ready to close their business, and for many of us, it can feel like a walk of shame. There's a lot of guilt. Oh, we failed. We didn't do the thing that we set out to do. We're pausing, and I know earlier you talked about it felt like giving up, and is it really giving up? I would love for you to expand on that, because for me, I was like, well, I have many ideas. This one thing doesn't define me. But it's one thing to say that aloud, but again, what was my body feeling? And so I think I went through the motions and I said, okay, I'm ready to move on for this thing that define me. Like I agree. I also didn't have hobbies. I'm like, I was taught you have to go 150% in, and I thought I was the venture. That was my sole identity, and I forgot to spend time on all the other things that I love, whether it's like a poetry slam or just biking, hiking. What are other things that I didn't do for the sake of being productive? I did it for the sake of being me. I lost that completely with my building my first venture. And so I was like, okay, this feels great having time to do all these other things. But then there's this massive thing that's still happening in the world at that time that continues to happen that also constantly reminded me I wasn't in control.
Yeah.
Anything, my family can, get sick or be hospitalized the next day. I could not be here tomorrow. And I think living with that and understanding I finally didn't have control, the control that my venture gave me for so long, it took a lot of energy and it hit my mental health. And I remember when I first, around 2022, post vaccine, felt like, oh, I can be productive again. I don't need to do the hobby thing. Now I need to figure out this next thing that define me. And I remember starting being in the road, Detroit, New Orleans, Los Angeles. And then I was at an event where it got shut down because someone got COVID. And that's all it took to trigger me. And I was back there when I was trying to get back to normal, be productive, to not feeling in control. And from that event, I had 3 months where my body shut down. I was tingling all over. Just my brain felt like it was on fire, electrifying, and and I was like, I, how do I stop this? I never felt like this before. To the point that I was like, oh, it can't be my mental health. I must be like physically ill at this point because it wasn't going away. I must have something. So I was going to the neurologist, the cardiologist, and all the gists that I don't even remember the names, all these specialists to try to
Oh,
solve me, to try
any
to
doctor.
fix me. And then I was like, at one point I had to come to terms. It's like, wow, the mind can have that effect in the body. And I had to come to terms like this is my anxiety. And the only way to get back to myself is to allow to be myself. So I don't know what process did you go through when it hit you, when you were closing your venture, where you're pausing. Did you experience um, that kind of burnout? Because for me, that was a shock.
I mean, first of all, I'm really proud of you for finding the strength, I guess, to listen to your body. That's really hard. Intuition is like everyone has it. Everyone has intuition, and also then your intuition gets your body like to tag team, and we still, kind of like doggy paddle away from it. And it takes a lot of strength to accept this news from yourself. So congratulations. My body didn't shut down in that way, but I definitely so, a tiny way that I was like, oh, clearly something is wrong is that I am a terrible sleeper. My entire life I've been a pretty terrible sleeper. I'm the kind of person who can sleep anywhere under any conditions, but I'm kind of only like a 6 hours to 7 hours of sleep, in 5 to 6 hours of sleep a night kind of person. And during the time right before I paused my venture, I would pass out and sleep all day Saturday. I'd like go to bed, I guess, at midnight on Friday night or whatever it was, and truly wake up at 2 p.m. And that's so out of character for me. And once I like got my life to a healthier level, it's never happened again. I'm the kind of person who is just up at night hoping that like something will show up and help me go to sleep. And that the way my body craved that rest. And that rest wasn't restorative. I'd wake up at 2 p.m. and feel sick and feel achy. It didn't, you think I'm going to have a lie and this is going to be so refreshing. It wasn't refreshing. I'd wake up and I guess my mind must have been churning in my sleep, or it's just the simple reality, as you've said, that sometimes your body is telling you to stop and you put like bandages on it and I like I was like I'm gonna sleep in on Saturday, or you like take a really like a warm bath and you do these I guess surface level aesthetic expressions of self-care when what you need is to consult your schedule and take two things out entirely.
Yeah, and I wonder when. did you, when you noticed that was happening, did you ask for help? How much did you try to do on your own, right? Because there's this like culture around self-care right now and like heal yourself. So I wonder like what was your thought process to get yourself to that healthier point?
I fortunately already had a therapist at that time. I think I began working with her in like November 2021. And I, officially closed my venture like in like I want to say April or May. And Holly, who I'm not currently working with, but is absolutely incredible, and I owe a lot to, was very blunt in many ways. She asked me to, Holly is not the kind of therapist who like lets you talk for 20 weeks of your life and nothing has changed. She like would at some point go, clearly you need me to say this explicitly, do this, don't do this, tell this, tell this person that. She'd like listen to me ramble for a couple of sessions and be like, okay, I'm going to offer some advice. You don't have to take it, but you should do this. And she told me point blank, I think this is completely unstable, and I'm not saying you should stop this thing or stop that thing, but something needs to go. You simply cannot you can't do all things. You just cannot do all things. You can't do all things in the same season. Maybe you're gonna pause this thing for the season and get back to it in summer, or just some configuration that's a bit different. Um, and I didn't listen to her for many months. But having someone say that to me, and I mean, I don't have an older sister, I'm the oldest. So I hope that I do this to my siblings and to other people in my life, just like, I'm not gonna let you make this mistake that I've made and other people have made. The correct answer is this, proceed with your day. And having her just say that, I know you're doing these things and I will teach you coping mechanisms to manage your anxiety and manage your stress, given that this is the scenario at hand. But actually, for real, long standing um, benefits, something needs to go. The correct answer isn't all these patchworks of things. And we worked a lot on, deep breathing exercises and the benefits of journaling. And she taught me a lot about accessing my support system. And that's a lesson, like learning how to I don't like, I don't know, your friends maybe work for your venture, maybe they don't, but there's a way that you can access their support and access their creativity and access their, strategic thinking skills to help you in practical ways with your venture. And there's also accessing them as just people who make you laugh and who you can make laugh and be a different version of yourself with. And we also discussed a lot about that accessing and how I spent all this time in my own mind solving all of my problems when I could have when I could have accessed people around me who were willing and able and excited to be invited. But at the same time, this support that exists doesn't mean that I didn't have to think really seriously about what had to go and what had to stay and what actually maybe it was actually just changing. I think I would love to hear how you feel because you've closed your venture and now you're in a sabbatical and you're in Vietnam. So that's a that's a big deal. But also things don't disappear entirely. They change, and the way you participate in creating change can evolve from running this venture that like is maybe on the ground, maybe digital, maybe advocating government, maybe like providing a service to young people, to a different way of driving change. But please tell me how you went from that point medically and physically to traveling the world.
Yeah, no, and I think also I don't want to ignore completely. I think mental health, right, well-being, it's a universal experience, right? We all have bodies, souls, minds, and hearts to take care of. But there's also the layer of society and systems. And I think for me, my first venture, I was doing diversity, equity, inclusion work for workplaces. And that was very much taxing from the beginning, where I constantly had to walk in the meetings and prove that my existence, my genius of young people of color that look like me matter and should be valued. But for some, that needed to be backed up by facts of why diversity was important. So imagine how they can be deteriorating over the years. And then you have a pandemic, which is massively, again, mostly impacting communities of color, lower income people. So I think by the nature of the industry, that also play a role, more of a role of why I closed my business and decided to put on my mask first, and decided to move on and have time to decide, is this the industry what I want to be? What role do I want to be in the world? Because I think our own existence also matter, our joy. We can't be the fixers for the world's problems. So I think that I want to acknowledge that play a role. And then when I was going from emergency room to a specialist visit, and eventually got my results, I said, well, it's not physical, it's mental. So I went through a similar process with you from now on, where I'm like, okay, I need better sleep. I need to eat my vegetables. I need to drink green juices. But I also lean in community a lot and realize the true power of that in friendship, the true power also of non clinical support. Even though shout out to the therapist, I agree. I'm glad. Shout out to Holly. Mine was Angelica and Angelica. It took me a while because I wanted to work with a Dominican therapist. I didn't. I was like, no one else is gonna understand the what I experienced with my mother and being separated for 7 years as a child due to poor immigration policies, but another Dominican woman who understands the context of my country and the experience in the US. So it took me a while to try therapy just because I didn't trust anybody. But therapy was definitely part of that solution, and also leaning into community. So I think I did acupuncture, I did Reiki, I got a personal fitness trainer. It's really a holistic process that it takes, because I think we forget, because life moves so quickly, how these things affect all parts of us. So I think the solution also had to be holistic. One thing wasn't gonna fix it. I think the challenge though is these things can also be get expensive. They're not as
Yes.
accessible, right? I was like, wait a minute, I want help, but if you want to go the psychiatrist route, it's like $400 appointment plus medication, and so now actually I'm building my second venture around making mental health more accessible, particularly holistic health for youth of color, and it started with my own journey. So I'm excited, but to do that, I was like, if I want to start a second venture, I need a break. Thank you so much for this space, for having this
Awesome.
conversation uh, with me. I learned a lot from you. I think we can all add to each other's perspectives on mental health, and because sometimes it takes someone else uh, seeing that something that we cannot see to give us ourselves that permission. So I thank you
Thank
for this
you.
time
This has
together.
been such a lovely conversation. I would love updates from the rest of the sabbatical. And enjoy yourself. Thoroughly enjoy this time that you have.